Let's delve into ACL injuries. In soccer, the incidence is estimated at 1.7 ACL injuries per 10,000 players annually, with the rates of 0.9 per 10,000 in males and 2 per 10,000 in females. While these figures may appear low, ACL injuries can have profound consequences, including extended time off and premature retirement. Therefore, it is crucial to have systems to manage and prevent such conditions from occurring. Neuromuscular training, a commonly used modality for managing ACL risk, has proven effective in enhancing lower limb coordination and optimizing knee biomechanics. It's been reported that this sort of training can significantly reduce ACL injury risk by 40 to 70%. Neuromuscular training includes various types of exercises, with plyometric exercises being one of them. Zeves et al. Highlighted that plyometric exercises combined with eccentric hamstring strengthening promoted neuromuscular adaptations, where the study had shown that this training increased electromyographic activity in the hamstring muscles, particularly the semitendinosus. The early activation of semitendinosus had shown also to reduce excessive dynamic knee valgus, a key driver to ACL injuries, thereby protecting the knee joint complex. Some of the interventions that a team can adopt include lateral jump with perturbation, tuck jump, single leg drop jump with a jump up to a step, a lateral jump and lateral jump to the center, and Nordic curls. These interventions are few literature has used in promoting neuromuscular adaptations, and are some exercises that the team can use during and both on and off training periods. So, to harness the full effect of these exercises, feedback and cueing should also be considered. As while these issues are less likely to be seen in men's soccer, the rapid professional development in women's soccer combined with lack of gradual exposure has led to many female soccer players developing maladaptive biomechanical movement patterns, and that literature indicates that feedback on performance can help reinforce proper techniques in players. With this in mind, players with maladaptive jumping, landing, running, or pivoting biomechanics should be supervised during sessions and cued to facilitate motor learning. Intensive blocks of trainings are preferable to catalyze the uptake of motor skills. As with normal biomechanics, shouldn't be excluded, but also to continue to receive feedback on their pivoting and cutting maneuvers during a short-sighted games. This approach is more specific to their game performance and the mechanism of injury, which is critical for any elite athlete's conditioning. The use of SSG can be further substantiated by Gochler's study, which demonstrated a link between neurocognitive functions such as working memory and inhibitory control and ACL injuries. And since 70% of ACL injuries occur in non-contact situations, indicating poor motor planning, incorporating technical feedback into SSGs could further reduce the risk of ACL injuries.
Various studies have shown that a deficit in core stability may lead to an increased risk of ACL injury, highlighting the importance of implementing core strengthening exercises into elite soccer training programs for injury risk prevention. Studies by Wilson et al., Jeong et al., and Sinar et al., respectively, all emphasize the importance of core stability, particularly in addressing its ability to reduce knee valgus and lateral trunk flexion during change of direction and cutting movements, which are two risk factors that appear to predispose an athlete to ACL injury. Soccer is an extremely high-demand sport that requires constant change of direction and frequent physical contact. These activities place significant stress on the knees. Players are constantly jumping, sprinting, and abruptly stopping throughout a standard match, which necessitates the engagement of the core muscles to maintain trunk stability. Core strength then plays a crucial role in sport-specific movements by enhancing trunk posture. During these high-intensity actions, core strength ensures that players can maintain a stable and controlled posture, which is essential for optimal performance and injury prevention. ACL injuries often occur during change of direction or cutting movements. Such positions put the knee in a vulnerable state, increasing the risk of ACL tears. These movements typically involve a laterally flexed trunk and excessive knee valgus, which is an inward collapse of the knee. The core strengthening exercises selected to implement among our elite soccer population are in line with the current studies which have shown significant improvements in knee angle valgus, knee flexion angle, and overall neuromuscular control of the lower extremities. By improving neuromuscular control through core strengthening, these exercises will help reduce the risk of knee valgus collapse and excessive lateral trunk rotation during dynamic movements. The training program consists of 8 exercises that will be completed 3 times a week. The session will be completed as a team prior to regular scheduled training sessions. The training variables of this program is prescribed for 3 sets, 30 to 60-second holds. The duration of the holds will be individualized depending on the capability of the player and can be modified depending on how they're progressing or regressing throughout the season. The exercises prescribed for the program include the following: sit-ups, hollow hold, back extension, supermans, front plank, back bridge, quadrupeds, and side plank. The exercise descriptions are clearly outlined so that any clinician within our high-performance team would be able to implement the intervention. As we've established, soccer is an extremely dynamic and unpredictable in nature, where change of direction and physical contact occurs regularly. These particular exercises target all planes of trunk to counteract the external forces that act on the body during these sport-specific movements. Ensuring that our athletes have strengthened cores will hope to translate to proper distribution and force generation of the kinetic chain during jumping, sprinting, and change of direction movements seen during training and gameplay. As a result, this prevention strategy should successfully allow our players to perform optimally with a mitigated risk of ACL injury.
As previously mentioned, neuromuscular exercises are highly effective in reducing ACL injury risks. However, neuromuscular training often includes a variety of exercise such as plyometric or eccentric work, which may be impractical due to their high load nature, especially during the in-season when the overall training load is already significant. To address this, the FIFA 11 Plus program can be utilized during the peak loading seasons, either as a standalone routine or as a complement to existing programs. The FIFA 11 Plus is particularly beneficial due to its simplicity and high specificity, where numerous studies have demonstrated the high external validity of FIFA 11 Plus program among soccer players. And research has shown that completing the FIFA 11 Plus warm-up routine before movement analysis significantly improved the knee valgus joint position in both females and adolescent male soccer players. These improvements correlate with epidemiological findings, which reveal that teams using the FIFA 11 Plus programs experiencing a 30% reduction in ACL injuries. When considering the FIFA 11 Plus program, compliance significantly impacts its effectiveness, as research indicates that teams completing the FIFA 11 Plus routine 40 or more times during seasons experience a 46% reduction in injuries. Moreover, high compliance with FIFA 11 Plus program not only reduced injury rates, but also positively influenced the overall team's performance, with higher compliance teams achieving significantly more wins. Sharing this information is an effective way to gain the buy-in of coaches and teams, and then emphasizing the dual benefits of reduction in injuries and improved performance associated with constant use of FIFA 11 Plus programs can make a compelling case for its adoption. And also, to further improve compliance, it is recommended to perform the program in a team environment, as group activities promote cohesion and increase the completion of the program.
The Nordic hamstring exercise will be a key component to our injury prevention program. Now, it's an exercise that will be a cornerstone of this effort. We'll incorporate this exercise regularly into our training sessions to improve eccentric strength. Additionally, we can use complementary exercises such as the remaining deadlifts to further target the hamstrings. Another important aspect is addressing muscle imbalances. We'll design individualized strength programs to correct any identified imbalances by monitoring or adjusting training loads. Proper load management is crucial for preventing overuse injuries. We'll implement periodization strategies to balance training intensity with added recovery. The first study done by Jones et al. Was the first to demonstrate a 10-week Nordic hamstring exercise training program that enhances the eccentric knee flexor strength of score players. Studies by Ishol and Lovell further supported this research with a positive strength response from soccer players who engaged in 10 to 12 weeks of Nordic hamstring exercise. Studies have shown that some clubs may not have the luxury of having such long preseason periods. So we look into a 5-week introductory period increasing from 2 sets of 5 repetitions one time in the first week to 3 sets of 8 to 10 repetitions 3 times per week by the end of the 4th week. Thereafter, participants perform 3 sets of 8 to 12 repetitions 3 times per week for the week 5 to 10. Research has also suggested that 2 exercise sessions per week appear to be sufficient stimulus to provide protective effects for hamstring muscles, which is consistent with the insights of on-field resistance training adaptation. Another study performed Nordic hamstring exercise that was performed twice a week with at least 48 hours breaks in between each session during a 4-week period, performed before regular soccer training, showed positive effects of preventative hamstring strains. Eccentric strength training incorporating the Nordic hamstring exercise. Our target identified a threshold of 337 newtons of eccentric knee flexor strength as a critical benchmark. Athletes who are below this threshold are at a higher risk of hamstring injuries. The risk of sustaining hamstring strain injuries decreased by 9% for every 10 newtons of eccentric strength increase of such muscles. Therefore, it is plausible that 53 newtons of eccentric strength increase observed in responses to the Nordic hamstring exercise training in the current study may have real repercussions on their susceptibility to hamstring strains along the future of their season. Research also suggests a ratio around 0.6 to 0.8 between hamstring to quadricep strength is optimal for reducing injury risk. While using exercises for eccentric loading, increases lengthening in the bicep fascicle length. Athletes with longer bicep femoris long head fascicles are at lower risk of injury. Specific benchmark for fascicle length can vary, but the goal is to increase fascicle length through targeted eccentric training exercises, such as the Nordic hamstring exercise. As we address imbalances, although between limb imbalances were not found to increase risk, we can still aim for a balanced development to optimize overall muscle function, and it is also advisable to aim for less than 10 to 15% strength difference between limbs to ensure balanced muscle development. Eccentric training plays a vital role in preventing hamstring strain injuries by increasing muscle tendon unit length, enhancing force production, and correcting strength imbalances. The evidence from various studies support the incorporations of eccentric exercises such as Nordic hamstring curls. Eccentric training offers a robust strategy for reducing incidence in hamstring strain injuries in soccer. In many strength programs, there is a notable gap addressing the unique demands of sprinting. This dynamic motion engages multiple joints, requires compound muscle actions, and demands an extensive range of motions. For example, the Nordic exercise, often touted for its efficacy in eccentrically strengthening hamstrings, only recruits about 40 to 70% of hamstring length, whereas sprinting necessitates a full 110% range of motion. Moreover, research underscores a critical aspect of injury prevention. Athletes consistently reaching over 95% of their peak velocity at least once a week are less susceptible to muscle injuries compared to those falling below 85% of their peak velocity. with literature emphasizing the importance of specificity in elite athlete metabolic, biomechanical, and psychological conditioning. Thus, for primary prevention, sprint training emerges as a critical intervention for mitigating hamstring strain injuries. While evidence suggests that repeated sprint training with a dosage of 2 to 4 sets of 6 to 8 sprints is highly effective in enhancing a player's repeated sprint ability, a critical performance criterion for soccer players, literature also indicates that 8 repetitions of maximum velocity runs, more or equal to 95%, represents the optimal zone for reducing occurrence of hamstring strain injuries, and higher repetitions to increase the likelihood of strains, as illustrated in the appendix. In balancing performance and prevention, it is crucial to consider the training objective when determining the appropriate dosage and timing within the season. Repeated sprint ability training can strategically focus on during the preseason or periods of low intensity, while bouts of 8 sprints per session may be incorporated throughout the week during high loading periods. Another crucial training variable to consider is volume or distance. While some literature advocates for higher volume over lower volume when building load resilience, it is essential to recognize that the sprinting imposes a significant load on hamstrings, leading to rapid fatigue. Research suggests that this fatigue can disrupt neuromuscular coordination, potentially resulting in maladaptive strategies. Studies have shown that during fatigue, there is a reduction of semitendinosus activity and an increase in bicep femoris longhead shear modalis pattern. This finding is particularly concerning because literature indicates that the bicep femoris longhead is most vulnerable to strains due to its long extension and small cross-sectional area of sarcomeres. Nevertheless, in Shah's recent studies, which examined the influence of weekly sprint volume and maximum velocity exposure on eccentric hamstring strength in professional footballers, it was discovered that weekly sprint distance did not significantly affect the eccentric hamstring strength. Furthermore, it revealed that increased injury risk was not associated with weekly sprint distance, but with rapid increases in acute workload compared to chronic workload. These findings emphasize the importance of graduated increments in sprinting distance followed by repeated sprint training progression.